Hello, everybody, and welcome to this episode of Got Transition Radio, brought to you by Got Transition, the National Center on Healthcare Transition, funded through a cooperative agreement with HRSA and the Maternal Child Health Bureau. For those who don't know me, my name is Mallory. I'll be your host, and I am the Youth Program Manager for Got Transition, the National Center on Healthcare Transition. Unfortunately, at the last minute, my co-host, who has joined me for the past couple of episodes, Teresa Nguyen, had a medical appointment come up for this morning, and as we at Got Transition know, health does come first, so she was not able to make it, and I am coming at you by myself today, but I'm kind of excited about that because we have a lot to talk about. So as always, before we jump into the heart of this episode, I want to just go over how you as a listener can share your questions and comments during this episode, because we really want this to be about you and for you to get your questions answered and get out of this what you want. So on your webinar control panel on the right of your screen, you will see a window that says questions, and you can type any questions or comments into that box. You can also use the chat window that is available in that same webinar box. So I will see these and respond to them throughout the episode. And if I do not get to them, I will follow up with you later, and they will be posted on the website with this episode after it broadcasts. So, since we are being pretty real on this show and talking about real things, we really can't deny what has happened over the last week for the city that I moved to, Boston. I won't go into too much detail about the tragedies that happened at the Boston Marathon. We've all seen the news. I will tell you that me and Owen were at the race when the events happened. We were not at the finish line, thank goodness, but we did almost go down there. We had friends down there, and everybody in the city has been really deeply affected, and we were one of the towns that had to go into lockdown that Friday following the marathon. So the good thing that has come out of it is another reminder of just how much of an amazing support system we have in Boston, but it's definitely been a very emotional week that none of us will forget, and we're all still trying to recover from it. You know, and as the funny thing is, as much as we talk about transition being a process of planning and preparation, the reality is that when things like that happen, it's not something you can really plan for. So I will say, since then, we have printed copies of our medical summaries and updated our emergency contact information for when we're apart, and it's really made us more aware of what we go through, you know, getting around the city, being apart, and, you know, what could potentially happen. But, you know, overall, we were able to support each other and turn to the good people that we are lucky to have nearby, and we're just so grateful that we and all our loved ones are safe and our city continues to rebuild. So it definitely has been a week. It's been an experience, and we're still coming down from it. But with that, we will get started with this episode and keep going with the normalcy that helps us recover best. So this episode is really a hot topic. We had a record-breaking number of people register, and so it's something that I really want to talk about, and I know a lot of people want to talk about health insurance. So since I did move to Boston, it has been a series of adventures trying to figure out my own coverage through Got Transition, and both Owen and I trying to navigate what services and coverage is available in Boston in a state where everybody is, quote unquote, required to have health coverage. And before we really get started, I want to stress something about this episode, and that is that the purpose of this episode is to discuss resources and what I personally have found to be helpful when I have run into trouble with my insurance. We at Got Transition cannot provide individual consulting or technical assistance to resolve conflicts that you may be having specifically, but what we are hoping to do is help you go point you in the direction of where you can find support either in your state or for more information that can help you answer some of the questions that you may have. So with that, I want to just talk about some of the basic provisions of the Affordable Care Act, or more commonly known as the ACA, specifically that will affect transition age youth or those young adults. And this part is going to be pretty brief. There's a lot we can talk about, and I can try to answer some questions later, but I want to leave you with some great resources as to where I found this information and to where you could read up a lot more about what affects you specifically. So probably the most talked about fact of the ACA is the big change that young adults will be able to stay on their parents' insurance until the age of 26. This, of course, does have some stipulations. That young person has to be either a full-time student or financially dependent with those parents, or single. They can, however, be married and on their parents' insurance if they qualify under one of the other stipulations, but that person's spouse, or if they have dependent children, they will not be able to be on that plan. So there's a lot of sort of loopholes, but overall it is a really good part of the act and one that's getting a lot of news coverage, so that is a good thing. Insurance companies cannot deny those with pre-existing conditions coverage. This was implemented for children under the age of 19 when the act first rolled out in 2010, September of that year. But it will not be applicable for adults over the age of 19 until January 1st of 2001. And there will be more options for people with pre-existing conditions, specific plans, etc., and that will be available in the link I share at the end. Removal of lifetime and annual caps on benefit plans. So if you are a person with very complex needs who has exorbitant health bills to exist on a daily basis, I'm one of those people. Insurance companies will not be able to put a cap on what you cost them. And so the lifetime cap was implemented in 2010, and the annual caps will be banned again January 1st of 2014. The last one that I think is really important to mention and will vary with what states decide to do is Medicaid expansion, both for income levels and age range. So there's a lot more information available on that. And as we talk about these things, I really want people to feel free to ask questions or share their experiences or any resources that they have found helpful as they begin and continue to educate themselves about this act and the changes that are rolling out. So before my personal insurance changed in October of this past year, I really wasn't very aware of what quote-unquote insurance coverage really meant. I did transition my Medicaid coverage when I began working after college, but after that and after selecting my plan with Got Transition with the help of my parents, all I really knew was that my needs were met and I didn't have too much to worry about in terms of getting things covered. Now, looking back, I realize just how lucky I was that that was the case. This past semester, I've been taking a class called Health Policy and Management, and we really have learned about the ins and outs of insurance plans, what it looks like for payers of healthcare services, the different types of plans, and what a consumer should know when selecting and using health insurance. And, long story short, I find myself going, wow, if I knew then what I know now. And I really wish that everybody who needed health insurance and had a way to get health insurance or didn't have health insurance could take this class and I could share all of this knowledge because it's so complex and vast, and there's so much that we as consumers need to understand when accessing the service that is healthcare coverage. And for me, the biggest thing that I can really stress about understanding your coverage is really just do your homework as soon as you can, either before or when you begin your coverage. If you get the opportunity to select your plan, really understand what you are signing up for. There's a lot of acronyms. When we were planning this episode, we talked about if I was going to use acronyms or spell everything out, but the reality is, in insurance lingo, they are just referred to as acronyms. So there are plans that exist that are called HMOs, or health maintenance organizations. There are preferred provider networks, which are PPOs, and some other ones. And it's really important as consumers that we understand what plan we have and what that means for us. And who you need to notify when you figure out what that plan is. So, my advice to you is, once you know what your plan is, if it's something you already have or something you're selecting, really just dig in and try to learn about it the best that you can. Read the benefits guide that is given to you when you enroll. Get on your insurance company's website. Make an account if you can so that you can log in and explore your explanation of benefits, see who your providers are. With the internet now, it's really easy to be involved in your insurance coverage. That was a huge step for me, was really just jumping in and kind of exploring things for myself. Usually there's a frequently asked questions link that you can research, or a way to contact them if you do have more questions. Once you figure out whether, what sort of plan you have, start looking at what's covered, what is your deductible, what do these things even mean. Most websites have a glossary, so you can kind of research these things as you run into finding words that you may not understand. One thing I've learned in understanding the ins and outs of an HMO, which is what I have, is that everything is centered around your primary care provider. And this is the way with a lot of healthcare that's rolling out with medical home and things that are called accountable care organizations. Everything goes around your primary care provider. So when you enroll with your insurance plan, you need to identify one. So I was really lucky because my current primary care physician was quote-unquote in-network, meaning that I could use him with my insurance plan until I was able to identify one in Boston. So when you get your first insurance card, it will have a place where your primary care physician is listed, and then to access services, you will need to notify your PCP to go through that process. So that's something that's really important to know, is to understand that they need to be the center of care. And so it's really important that you have a primary care provider identified, one that you can ideally actually communicate with and get a hold of. So the other really, really important thing is not just understanding what's covered under your plan, but what that means for you. What services do you need that are either out of network or it says will not be covered, and what is the process that you need to go through to still be able to use those services that are essential for you. This was the example of an issue that I ran into when my insurance switched to an HMO. My home care company that delivers my medical supplies that I need to live did not contract with HMOs. in this way. So when I called to notify my providers that my insurance changed, because you need to keep people informed so they know who to bill when you require daily medical supplies, they told me that they didn't work with HMOs, and so I needed to go through the process of getting what's called an authorization. So I thought this would be, not much of a big deal, and I could just kind of, call my insurance company and my doctor and get this rolling. But the reality was that it took many months, actually, to get everything squared away, and there were, with all the parties talking to one another, there still was not a clearly spelled out process, so it did get kind of complicated. But through this process, I really learned a lot, and the most important thing I learned was identify your go-to person. As soon as you are enrolled in a health insurance plan, or if you already have one, identify a case manager or a caseworker. They give you the option when you are enrolled, and so I called my company and they set me up with a nurse who asked a lot of basic health questions, thinking that I would be sort of this more simple consumer who just kind of wanted to talk about either weight loss or healthy exercise or things like that. And I explained my situation and what I needed, how to get an out-of-network authorization for this complex health need I had. And ultimately, it sort of ended up that her and I learned together, but she was really great, and we had some great conversations, and she always got back to me with who she had talked to and what had happened. But the reality was I had to get people talking to one another. I had to find time to make those phone calls, to talk to my doctor's office, figure out which provider needed to submit the letter of medical necessity. I had a wonderful nurse, fortunately, at one of my specialist office who played a key role in getting these various parties to talk to one another, but it turned out that it still had to be my primary care office. So it's definitely a process, and you have to really just be prepared for that constant advocacy. And you unfortunately are going to have to be the one to follow up and follow up and follow up. The case manager is a really great go-to person to find out where things are at, and they can log into the system to see if those authorizations have been processed and where things are at. But you will be the one who has to ultimately find out if people are talking to one another. So it can get kind of complicated, but there are allies for you. The other thing that I have found to be really helpful is there's an app for that. Like I talked about the website, another thing is that my insurance company has a mobile app, and I bet a lot of them do now. So research that, and for me, I'm able to bring up my insurance card just right on my phone without having to take a picture of it or anything. It's all stored in there. And also member services. Store it in your phone right away, whether there's an app or not. Again, if you have a caseworker, figure out what their contact information is the most direct way possible. With their extension and all of that, so that you have easy access and you don't need to research it each time you need to call them. And I just want to take a second. One of our listeners mentioned something that I had made a mental note to mention and almost forgot. Another great resource that I didn't mention in this presentation are benefits counselors or benefit consultants. When I did have to transition my Medicaid to a program for people who work, it was a benefit specialist who referred me to the program that I needed to be on, and I was able to access them through our local hospital. So if you do have questions and things are more complicated for you individually, you can research benefit consultants in your area. And this person also said that benefit consultants can get you quotes from several different providers, and most get paid when you enroll, so they don't charge you for finding quotes of what may be the most affordable way to access care. So thank you so much for sharing that. That's something that's really invaluable as you are trying to navigate services and find out what is the best for you accessing care. So these are the resources that I want to take some time to go over briefly. Healthcare.gov is one of the most reliable sources out there about the Affordable Care Act and health insurance in general. I've included the homepage as well as a glossary that's available on the website. Everything from A to Z, every word that may be used in the context of healthcare coverage is on that website. You can go through a finder, or there are different tools where you can put in your information and find out how the ACA will affect you. There's just loads and loads of information, and because it's a .gov website, you know that it's reliable. Another wonderful resource that I have referred to over and over again with my own transition is the Catalyst Center, which is the National Center on Financing Healthcare for Children with Special Health Needs. And they are our partners in a lot of the work that we do. And below the homepage link, you can see is a publication that maps out specifically what different provisions of the ACA will mean for children with special health care needs. So that was where I pulled a lot of this information, as I'm still learning about it myself. So I really encourage you to go to their website and look at some of the publications. They also have done a lot of webinars talking about the changes and what has already been implemented and what it means. They know a ton about Medicaid and children's health insurance programs. They're just super wonderful, really informative. And so, I encourage you again to really check out their website. And if something doesn't get answered there in one way or another, then you may have a really, really tough question. Young Invincibles is an organization in, I believe their home base is out of California and DC. It's sort of a virtual center. But they do a lot of work around healthcare coverage for young adults. They're not so much focused on children with special healthcare needs, but they have a glossary again, and another really cool app that lets you find providers based on your state. So that's a great website to check out as well. And of course, my email is there. If anybody has any thoughts or comments that we don't get to after this broadcast, you can definitely contact us. And somebody has asked to copy the links into the chat window. We are having a discussion about how to make those live. So we will make sure that everybody has access to the links. They will be uploaded on our website within the next couple of days. So if I'm not able to paste them right now, we will get them out to you very, very soon. So at this point, I want to take some time. We have a couple of questions and comments coming in from our listeners. Hang on. I'm going to share the contact information for the Catalyst Center. We have some representatives there on the webinar, so I am gonna put that in the chat box. Thank you, Beth, for that. And we also have a lot of great things coming up with Got Transition. As always, you can find our past broadcasts on iTunes, on our website, or also on our Facebook page. Our next episode is going to be at the end of May, and it will be about medical limitations, blaze the trail or head for the hills. And what this means is how, over the course of my experience and people that I know, how we have seen that opportunities for development professionally and personally, opportunities that most students have, such as studying abroad or moving to a new state, going to grad school, those opportunities are not really set up for people with complex health needs or disabilities. So how can you, as somebody who wants to pursue those opportunities, make it work for you and make sure that your health doesn't suffer and that you're able to get the most out of it while still getting your needs met? So I think that's going to be a really interesting conversation. The other thing I want to mention is we have created a survey for our listeners of the radio show, and I will put this in the chat window at the end of the broadcast. We've done this radio show for a little over a year now, and we have had amazing participation. So we really want to hear from you about what this radio show has been for you. How do you listen? When do you listen? What would you like to hear more of? What would you like to change? You know, we have a new cycle of funding coming up, and you know, there's going to be some changes with that transition, but we really want to make sure that we continue this dialogue and hear from you about what you like or what you would like to see changed. So again, that link will go out and be on the website, and I'll post it in the chat window in just a second. So I think that will be a great way for us to really take your feedback and make this radio show even better. Again, Got Transition, that's our website right there, gottransition.org. We have a Facebook page that is really active. I like to think we have over 300 followers. We have dialogue with a lot of our partners who are also doing transition work, and our Twitter page. So I would love to open it up for any more questions or further comments about some of the things that we talked about today. And I will post the survey link in the chat window as well. And if you don't have any questions right now, or you do think of things after the fact, I encourage you, as always, to email me or email Anne. All of our information is on the website. And we actually have a comment from somebody at the Catalyst Center saying that I was confused about the coverage for people over up to the age of 26, that they do not have to be financially dependent to benefit from that extension. So again, I am not the expert in this. I'm learning as I go. So please check out that publication. That has it all mapped out. I could have easily misread things. I know there are always complications, so I probably am making things more negative than they need to be. But thank you for that feedback, and I will make sure to get the correct information before we put the slides up. So we have a couple more minutes if anybody has any other questions or feedback. And again, I have posted the survey in the chat window, so it is an active link. I would love for people to fill that out. It's very brief, takes about 60 seconds for you just to fill that out and give us some feedback about your experience with Got Transition Radio. So with that, I would love to thank everybody for joining. These episodes always go by so quickly, but I hope that this was informative for you, and we will follow up with additional questions and have this broadcast as well as the resources posted on our website in a couple of days. So thank you for tuning in, whether this is your first time or you are a returning listener. And remember, every transition is unique, just like you.